was born with only one kidney, and the kidney I did have was diseased. I was diagnosed with IgA nephropathy, which turns your kidney into a battery that's slowly dying. I was worried about not being around for my wife and daughter.
When Mike first came to us at New-York-Presbyterian Columbia, his kidney function was declining very quickly, and kidney transplant was really the best option for him.
I love this one. I'm Dr. Caroline Miranda, his little sister and kidney donor. I am a neurologist and I work at New-York-Presbyterian Columbia. Getting the call that I was the perfect match, I was nervous. Suddenly I was going from being the doctor to being the patient.
My one kidney was close to failing, so I was frankly worried about not being around for my wife and daughter.
Restoring him to health as quickly as possible was imperative, and we knew that a robotic, minimally invasive approach to his kidney transplant would be able to do that.
My surgeon was Dr. Ratner.
Now with surgical robots, we're able to offer minimally invasive surgery. You make a little incision, you put a fiber optic TV camera on the inside. The visualization is much, much better with the robot.
It could be done so much more precisely and safely. I had full confidence in him and was actually looking forward to this procedure.
This was the first fully robotic, simultaneous living donor kidney transplant performed at New-York-Presbyterian Columbia.
We're very fortunate that we have the robotic capacity and that we have robotic surgeons. We can do robotic surgery of the donor and recipient simultaneously.
Everything went great. This is the kidney that Mike's sister donated to him. The blood flow to the new transplanted kidney looks excellent.
Recovery went very well. I was out of the hospital after 4 days.
Being Mikey's kidney donor has made me fall in love with the field of medicine all over again. It was humbling, and I just have such deep admiration for the entire team behind this process.
We do this to be able to see people living their best lives. It's a very gratified feeling.
Life is great now. I'm 3 months out of surgery. I feel great. Caroline changed my life and gave me life, so I'm forever grateful.
Love you too.